Good morning everyone. My name is Dr. Anil Raheja. I'm a consultant orthopedic surgeon. My special area of interest are arthroplasty and joint preservation. तो आज हम डिस्कस करेंगे नी पेन के बारे में और हम सब एज ग्रुप को कवर करेंगे. नॉर्मली जो है हम सिर्फ ओल्ड एज में या सिर्फ सर्जिकल डिस्कस करते हैं, लेकिन आज हम हर एज ग्रुप को डिस्कस करेंगे, स्टार्टिंग फ्रॉम अर्ली एज ग्रुप लाइक यंग एज में फ्रॉम स्टार्टिंग फ्रॉम 20 ईयर्स टू 60-65 ईयर्स तक. ठीक है, तो मेन कॉज लेट स्टार्ट विद द यंगर एज ग्रुप फर्स्ट. तो यंगर एज ग्रुप में लाइक बिटवीन 20 to 30 years द मेन कॉज ऑफ नी पेन इज सम सॉर्ट ऑफ स्पोर्ट्स इंजरी और cartilage problem. So sports injury can occur, as you know that this age group is very active in sports and they are physically very active. So they can have sports injuries like by twisting of knee while playing football, while playing cricket, or by suddenly changing in direction while playing basketball. तो इसका अगर टाइमली ट्रीटमेंट नहीं होता then it can lead to problems later on in life. The other cause of knee pain in relatively younger patients is chondromalacia, यानी कि इसमें cartilage की weakness शुरू हो जाती है. As you know, cartilage is the rubber which lines the knee joint. So this becomes soft in chondromalacia and particularly under the patella. So when you do squatting or sitting cross-legged, this causes pain. And in chondromalacia, rest will bring stiffness. As the patient takes rest or the patient starts walking after 2 to 3 hours, patient will have pain. This is called as cinema sign. So patient will have difficulty in climbing stairs, getting down the stairs, while getting up from the floor, getting up from the chair also. And mostly other causes of knee pain are poor physical fitness, like patients who have sedentary lives and they start running 5 kilometers suddenly, then they can have issues with their cartilage and various ligaments in the knee joint, and that can lead to pain. Another cause of pain can be patellar maltracking, that this patella bone, when we flex, it glides smoothly over the femoral condyle. But if there are maltracking issues, that it is going lateral side or medial side, then it leads to degeneration of cartilage in the patella, which leads to knee pain. And another rare cause of knee pain in these younger age group is inflammatory joint disorders. So what is the treatment of the knee pain in these younger age group? So one is weight loss, because the incidence of obesity is increasing in the younger age group. So weight loss, if the weight is more, that puts more load on the cartilage, more load on the ligaments, and so weight loss definitely helps. And they should do low impact exercises, like they can do walking, they can do swimming, but they should avoid skipping or jumping or running. And another is they can have mild painkillers. But the important thing is, when should they contact the doctor? So when pain which is not relieved by rest, pain which gets worsened at night, or there is an instability of the knee joint when they are walking, or there is a locking when there is when they walk and then sudden catching of knee joint is there, and if there is associated fever or history of weight loss, then they should contact doctor. So and what are the other surgical treatments which can be helpful for pain relief in these patients? So one is, if there is a ligament tear or there is a meniscal issue or there is a cartilage issue, that can be dealt with arthroscopy or keyhole surgery. In keyhole surgery, we just make 1 centimeter incision here and 1 centimeter incision here and put our scope inside. Then we inspect the whole of the knee joint. We see the cartilage condition, we see the meniscus, the washers, we see the ligaments and evaluate it. And if there is a problem there, then we can correct it simultaneously. Another is, if there is a cartilage loss in the younger age group, or there is a disease called as osteochondritis dissecans, then we might have to do a joint preservation surgery or change in the angle. If there is a knock knee also, or the bow legs are also associated with. So we have to do atypical osteotomy or distal femoral osteotomy. That is, we make a cut in either in the tibia or in the femur and correct the alignment according to the deformity and unload that particular area of cartilage loss. So these are the main causes and treatment of pain in relatively younger age group. So the next age group we will take is patients who are between the age of 40 to 45. In these patients, the main reason of pain is a degenerative joint disorder mainly. That is, the cartilage which was soft and flexible in the younger age group becomes hard and inelastic, and then the nutrition also becomes less. There is a fissuring of the cartilage, and there is a gradual degeneration of the cartilage, and the quality of cartilage becomes poor, and which makes them more prone to further degeneration. So the main cause of pain in 40 to 45 is early onset of degenerative joint disease. Another main reason in this age group is obesity. If a patient is obese, say 1 kg of extra weight puts around 3 to 3.5 kgs of extra weight on the knee joint. So it means if patient is 10 kg obese, then the load on the knee joint is around 30 to 35 kg. And simultaneously, if patient loses 1 kg, so that will help in reducing the load on the knee joint. Another main reason of pain in this age group is onset of inflammatory joint disorders. In 4th decade of life, mostly the rheumatoid arthritis or other seronegative spondyloarthritic diseases, they get settled in, and they also lead to destruction of the joint cartilage and pain in the knee joint. And another cause is metabolic bone diseases like gout. In gout, what happens is the uric acid level in the blood goes up, and that leads to crystallization, formation of uric acid crystals in the joint, which leads to pain and swelling. So what should they do to avoid pain in the knee joint, or they can prolong the life of the knee joint? So that is, one is avoidance of alcohol. So if they take alcohol regularly, there's a chances of metabolic bone disease are very, very high. Another is they should quit smoking and seriously consider weight loss surgery. As I already told that 1 kg of weight loss will lead to removal of 3.5 kg weight on the knee joint. So that will make their life easy, make them more flexible, let them walk more. And when should they contact doctor, right? So when the pain is not relieved by simple home remedies, or there is a weakness in the joint, there is a locking in the joint, there is a swelling in the joint, there is a stiffness in the joint, or there is a redness in the joint. And another thing is, what should we do to get a good sleep if you have knee pain? So the thing is that one should keep a pillow between the two legs if they are lying on the side, and even if they are lying straight, then on their back, then also they should keep a pillow between the two legs, and a little temperature on lesser side, not a very warm room temperature. The little less temperature in the room also helps in having a good sleep. And we should sleep on a very firm, in a good quality mattress, right? Very soft mattress in which there is a sagging of the mattress will lead to disturbed sleep. As we sometimes go to hotels and there are very, very soft mattresses, so everyone has a sleep difficulty then. So once you have the problem which I've already told, that pain is not relieved by the home remedies or weakness or swelling, then they should contact a doctor. Once they report to us, then what we do is first we get a standing x-ray of the knee joint, right? So standing x-ray of the knee joint is very important because that tells us about the quality of cartilage degeneration, how much the degeneration is there, whether there is some osteophytes. में जैसे कहते हैं हड्डी बढ़ गई है, तो हड्डी तो नहीं बढ़ी हुई है, या पेटला की पोजीशन क्या है, और उसमें पेटलोफेमोरल जॉइंट की क्या कंडीशन है. So we take special views to assess पेटलोफेमोरल जॉइंट. तो इन सब को देख के हम जो जॉइंट के कितना लेवल है डिजेनरेशन का वो हमें पता लग जाता है. और अगर लॉकिंग है या इंस्टेबिलिटी है, देन वी गेट MRI also done. And in MRI we assess the cartilage, then we assess the ligaments, the meniscus, the root of the meniscus. So we assess many things on MRI, and then we help in getting the appropriate treatment to the patient. So what are the treatment options available in a patient who is having a degenerative knee disease at the age of 40-45, because they are too young to get total knee replacement? So once we advise them to take weight loss very seriously. Another is we can offer them joint preservation surgeries like a high tibial osteotomy. I've already told that we make a cut and then correct the alignment of the knee joint, and that leads to unloading of the damaged cartilage. Then if needed, we can do arthroscopy. We can put scope inside, and if there are loose bodies, we can remove that. If there is a chondral flap, cartilage के लटक रहा मतलब फटा हुआ cartilage है, तो उसको भी हम correct कर सकते हैं. And if it is a grade 4 cartilage loss, then we can offer them partial knee replacement in these cases. In partial knee, there is no need, like this is a model of total knee replacement in which both the condyles have been replaced by a metal prosthesis on the femur side, a metal prosthesis on the tibia side, and then a poly in between the two. So this is a total knee replacement. In partial knee replacement, what we do is we just remove the half of the cartilage and replace it with a metal prosthesis. So that's a partial knee replacement. It's a surgery which is going on for many years, right? But now it is becoming more popular as the age of the patient is decreasing and patient is getting younger. Younger patients are also getting disease. And in in 40 to 45, sometimes we have to do a total knee replacement if both the compartments are damaged, or if there is a inflammatory joint disease which eats up both the cartilage in both the compartments. For those, we offer them a total knee replacement. So what happens in patients in 60 to 65 years and above? So in those patients, the main cause of joint pain is osteoarthritis of the knee joint. That is, the cartilage gets eroded completely and the subchondral bone is exposed. And whenever they walk, there is a pain. Then there is a osteophyte formation here, जिसको कहते हैं कि हड्डी बढ़ गई है, गैप कम हो गया है. तो ये सब चीज़ें होने के बाद जब ग्रेड 4 आर्थराइटिस हो जाती है उनमें, तो उन केसेस में देन वी ऑफर देम टोटल नी रिप्लेसमेंट. सो व्हाट इज़ न्यू इन टोटल नी रिप्लेसमेंट? नया क्या है नी रिप्लेसमेंट? नी रिप्लेसमेंट तो 25 साल से हो रहा है, 30 साल से हो रहा है, 40 साल से हो रहा है. तो नया क्या आ गया नी रिप्लेसमेंट? सो नया आया है द टाइप ऑफ प्रोस्थेसिस विच वी आर यूजिंग दैट इज़ मेंट फॉर इंडियन पेशेंट. एशियन नीज के लिए बना है, जो कि फ्लेक्शन ज़्यादा यानी कि घुटना ज़्यादा मुड़ जाता है और पेशेंट एक नीची जगह पे भी बैठ सकता है. पहले जो प्रोसेसेस डिज़ाइन थे वो सारे वेस्टर्न पॉपुलेशन को देख के डिज़ाइन होते थे, जिसमें 90-95 डिग्री या 110 डिग्री was considered to be a very very good range of motion, but now the patient are demanding more. So knees have been designed to increase the flexion, right? So deep sitting can also be allowed to these patients. Another is pain relief. पहले हमारे पास जो पेन रिलीफ का था वो सिर्फ एक एपिड्यूरल यानी कमर में एक ट्यूब लगा के उसमें ड्रग्स दे दिया करते थे जो 48 आवर्स तक चलती रहती थी. तो आजकल हमारे पास नर्व ब्लॉक्स हैं और हमारी एनेस्थीसिया टीम इज़ वेरी वेरी एफिशिएंट इन गिविंग दोज ब्लॉक्स. वी गिव फेमोरल नर्व ब्लॉक, वी गिव ACBs ऑल्सो एंड अडक्टर कैनाल ब्लॉक बोलते हैं जिसको. उसमें क्या है कि पावर लॉस हुए बिना patient get good pain relief, and during surgery also we infiltrate some local anesthetic around on the posterior side of knee and on the anterior side and sides of the knee also. उसमें सुन करने की दवा होती है, उसमें एंटीबायोटिक होता है, उसमें 3-4 ड्रग्स की कॉकटेल बना के हम लोग इसमें नी में इंजेक्ट कर देते हैं, नी के सराउंडिंग एरिया में. सो इमीडिएट पेन रिलीफ काफ़ी कम है उसको, और बाकी रिकवरी भी काफ़ी फास्ट ट्रैक हो जाती है. एंड वी with the help of these two blocks and periarticular infiltration, we can make the patient walk on the very same day. Sometimes our patient is walking 4 to 6 hours after the surgery, knee replacement surgery. Now third is robotic joint replacement. So now we have acquired a robot also राइट। उसमें क्या है कि रोबोट जो है वो एक्यूरेसी ऑफ जो ये हम जो ये इम्प्लांट लगाया करते थे वो एक जिग की हेल्प से लगाया करते थे। अब रोबो की हेल्प से हम पहले एक सीटी स्कैन करा के, कुछ रोबोज में सीटी स्कैन भी नहीं होता, लाइव होता है, तो उसमें हमारी जो एक्यूरेसी है वो काफ़ी इम्प्रूव हो गई है और जो आउटलायर्स थे वो काफ़ी कम हो गए हैं। यानी कि अगर हम जॉइंट की प्रोसेसेस को सही डायरेक्शन में, सही लेवल पे जॉइंट कट्स दे के डालेंगे तो उसकी उतना ही बढ़िया हमें पोस्ट ऑपरेटिव पीरियड में रिज़ल्ट मिलते हैं, उतनी ही रिकवरी क्विक होती है। तो रोबो आने के बाद ये सब चीज़ें काफ़ी रिजल्ट्स में इम्प्रूवमेंट हो गई है और अब एक्यूरेसी ऑफ जॉइंट इम्प्लांटेशन हैज़ इंक्रीज ट्रेमेंडसली विद द एडवेंट ऑफ रोबो। और रोबो पर्टिकुलरली उन केसेस में बहुत हेल्पफुल है जिनमें मल्टीपल सर्जरीज हैं, जिसमें ऊपर प्लेट डली है, नीचे प्लेट डली है, कन्वेंशनल जिग्स नहीं लगा सकते हैं जिनमें हम, उन केसेस में रोबो पर्टिकुलरली इज़ वेरी वेरी हेल्पफुल in getting the accuracy of the placement of our implant. So friends, these were the our topic of today, that what are the knee pain, causes of knee pain in young adults and middle age group, and I hope it was helpful. Thank you very much.